Hey everybody, Dr. G here. I'm a licensed clinical psychologist and body language expert, and today we're going to be analyzing Taylor Schabusiness's behavior and body language during Phase 2 of her trial. My last video covered Phase 1, up to when she was found guilty for the murder of Shad Thyrion. Phase 2 covered whether or not she had a mental defect or disease that would have prevented her from knowing the difference between right and wrong at the time of the murder. The jury, in fact, still found her guilty, and today I'm going to explain why I believe personally that the jury got it right. Before we get started, I do want to remind you that I have not personally evaluated Taylor Schabusiness. These are just my opinions based on publicly available information. In addition, I do want to remind you to like and subscribe if you want to see more content just like this. All right, let's jump right in. So Phase 2 of the trial is really meant to determine her sanity, for lack of a better term. And we're going to be looking at a lot of psychological content today. We're going to be looking at psychologists talking about her and various evaluations they did, and I'm going to try to help you make more sense of that in addition to looking at some of her body language. The first part we're going to watch is going to be Taylor Schabusiness as her father takes the stand to provide testimony.
You were living in Green Bay, correct?
Yeah, you know that, Chris.
Okay.
So as a surprise to no one that's watched the trial so far, she's already starting with the inappropriate laughter, seeing her father providing testimony. Let's keep going.
Correct?
Yeah, you know that, Chris.
Okay. And your daughter is Taylor Denise Schabusiness, is that fair?
She is.
Do you know anything about her employment history as an adult?
Sure.
And had she held jobs in the past?
Oh, yeah.
So this looks like a more genuine and natural smile than she's had. Oftentimes the smiles that she shows look a little bit more performative. I think that she may actually have pride about her work history. She may actually feel some pride about having held jobs. So I think we're seeing a bit more natural body language here.
Yeah.
Do you know where she worked?
She worked for Saputo. She worked a couple years, Saputo, 3.5 years probably.
And as you can see, she's nodding her head right there. So what we're seeing is that for people who've claimed that she's truly detached and is seeing things and doesn't know what's going on, I think this is evidence that she in fact does. She's responding appropriately. She's hearing her father talk and she's paying attention. So as you can see, she's interacting appropriately in this situation, which is one of the rare moments that we've seen throughout this trial. Let's watch this interaction again.
And had she held jobs in the past?
Oh, yeah. Yeah.
Do you know where she worked?
She worked for Saputo. She worked a couple years, Saputo, 3.5 years probably.
And is that relatively recently? Prior to her arrest, of course.
Well, yeah. Yeah, right. Yeah, right. Prior to.
And
She was doing really well there, too, until her boyfriend/husband got out of jail. That turned everything upside down.
yeah, in part because of the methamphetamine use, right?
Yep.
All right, so now I want you to go back and watch this again, but I want you to focus on her brow, and then we're going to talk about what we're seeing.
/husband got out of jail. That turned everything upside down.
Yeah, in part because of the methamphetamine use, right?
Yep.
All right, first we saw her eyebrows raise up. In the middle here, we saw this part raise up. And at the angle they were raised, it's what appears to be sadness. That's the first time, at least that I've observed sadness throughout this whole trial. So talking about her getting back on meth, I think there's some genuine sadness associated with that. Watch closely right here. I'm going to try to zoom in.
Got out of jail. That turned everything upside down.
Yeah, in part because of the methamphetamine use, right?
Yep.
And that sadness turns to anger very quickly. Now, I don't know if that's that she's trying to cover up her feelings or if she starts to get irritated thinking that she's being judged about her meth use, because it is very, very extensive based on what we know.
So Taylor was doing pretty well, and then she started using the drugs.
Yeah.
All right, and now we're seeing her stretch and wiggle a little bit. Now, this is unusual for her. We haven't seen a ton of this. And this is something people do when they're feeling uncomfortable, they're feeling unsettled. Having her father talk about these things, there may be some genuine feelings of regret here. There may be some genuine feelings of shame or embarrassment. And we're seeing her move around a bit more, possibly because of that.
No further questions.
Pretty bad drug, too.
Anything on that, Mr. Freilich?
Let's watch that again.
Methamphetamine use, right?
Yep.
So Taylor was doing pretty well, and then she started using the drugs.
Yeah.
No further questions.
Pretty bad drug, too.
Anything on that, Mr. Freilich?
What was the drug?
Meth, heroin, whatever else. I don't know.
Now we're going to watch some of Dr. Diane Litton's testimony.
And what is your occupation?
I'm an independent forensic psychologist.
Your Honor, can I have permission to approach?
You may.
Thank you. Dr. Litton, I'll show you what's about that.
She's highly amused by the cameras. Once again, we saw this during phase 1, just playing it up for the cameras. This is not insanity that we're seeing. This is just someone who is trying to put on a show, in my opinion.
Yes,
Can you tell me what that is?
that's my brief resume.
And does your resume or
To me, it's off the scale. 32 years. I've seen a lot of psychotic people, bipolar, psychotic, manic, and I just haven't seen very many like this.
So this is one area. Clearly, Dr. Litton is extremely well established. She's got a great resume. She's got a great history in what she's done. She seems like a very good forensic psychologist, but her and I view behaviors like this a little bit differently. Oftentimes when I see someone that is off the scale, if you've got somebody that presents in a way that's so unusual that you haven't seen it before, the first thing that I would do, and I have done this, by the way, so I'm not just talking, this is actually how I've practiced, you go, okay, is this person malingering? Because typically, if you've been working in this field for a while, you've really seen it all, particularly if you've worked in forensic settings like she has, or if you've seen patients like I have. And the thing to understand is that when you have outliers, that's when you do additional tests. That's when you go, okay, something about this is unusual. Like, this isn't really making a lot of sense to me because this presentation is beyond what I've seen. So let me make sure that this person isn't malingering, that there are all these other factors accounted for. So this isn't really a criticism of Dr. Litton, it's just a disagreement. One thing that's very important to understand is that when I've worked with a lot of folks with psychosis, the big problem with them above anything else is fear. They're paranoid. The delusions are based around fear. Everything is scary to them. And so if they do something that is violent, which is highly unusual, just to be very clear, it's very unusual that someone dealing with a psychotic disorder is actually violent. So I don't want to characterize people that deal with these issues that way. But if in the rare chance it is, it's out of fear. The violent behavior that Taylor Schabusiness engaged in was not out of fear. It was not in a place where she was vulnerable or scared. It sounded like she did it for fun or out of for curiosity, or because she was on so much methamphetamine that she engaged in violent behaviors secondary to using drugs, not because of a psychotic disorder. I know this is really difficult stuff to fully wrap your head around, probably, if you haven't seen it, but understand, I fully respect what Dr. Litton is saying, but I do disagree with her interpretation of what she's seeing.
Really bad depression with bipolar 1, super duper suicidal type, real depression. And then they have to have in their history at least one of these real super duper elevated
Not trying to make anybody uncomfortable here, but it's just remarkable how long she stares at the camera.
moods. And it's bizarre when you see it. It's pretty bizarre. Yeah, so that's basically it.
So you needed at least one manic episode.
Yes, I believe that that's in the diagnosis.
And in order to diagnose a manic episode, there are 4 criteria, aren't there? And you would agree that's been a concern for evaluators who have met with Ms. Schabusiness.
Yes.
Dr. Seipel had that concern, did he not?
I think he concluded, if my memory's right, I think he concluded that's it, yes.
I think you're right. Dr. Seipel concluded she was faking, right?
So for me as an evaluator, when I get reports and somebody has found somebody to be faking bad, that is a massive red flag. So if I was to ever come to any conclusion after that, that malingering was in fact wrong, or that clinician was in fact incorrect, I would have a lot of information. I mean, a ton, a mountain of information providing reasons why that is absolutely wrong. Because I do trust other clinicians' judgments when it comes to malingering. I don't know a lot of clinicians. I can't think of a single time that I've had a clinician believe that someone was malingering and they were just wildly wrong. I'm not saying it couldn't happen, but I haven't seen that before, because psychology, generally speaking, and I know this isn't universally true, but generally it's full of compassionate people. We want to see the best in people. And so when we see someone who is malingering and someone identifies that, typically it's something that's pretty in your face. They've usually got some pretty good evidence for that.
Yeah, I believe so.
And it was a concern raised by Dr. Lucetta, was it not?
Yes, definitely.
So having two doctors now that are concerned about malingering, that would be beyond a red flag for me personally, and it is as I'm watching this.
And again, she was a
Intern?
expert retained by the defendant.
Yes.
And that she suggested these potential for feigning should be explored further.
Exactly.
I wasn't suggesting that. What I was suggesting is you mentioned that you need to take that test into account and see if it's accurate, essentially, right?
If you've done the test.
All right, so now you see her stretching again when they're talking about malingering and whether or not she's faking bad. Maybe it's a coincidence. Maybe it's related to this is once again another area that's stressing her out a little bit, even though she's trying to keep herself entertained by staring at the cameras, making faces, smiling, all of this stuff. I think that there are some things that actually are stressing her out.
Yeah, sure. Or if somebody else, like in this case, it had been done by all these other people, so I consider that information, and that they.
So that's all we're covering for Dr. Litton's testimony. Clearly, she is a very reputable psychologist. Clearly, she has done and continues to do a lot of good work, but I do interpret the information that has been provided a little bit differently than she does, as do some of the other psychologists that we're going to see. Let's keep going. So now we're going to watch some testimony by Dr. Matthew Seipel. He is a forensic psychologist who currently conducts forensic assessments, something that I have a lot of experience with myself. All right, let's watch.
And so according to the Wisconsin jury instructions, mental disturbance brought on by voluntary substance intoxication is not considered to be a qualifying mental disease or defect.
You cannot be considered mentally having a mental disease or defect if it's because you were on substances at the time. That cannot be the reason you engaged in that behavior, and that's really what they're talking about right now.
And so to the extent that an examiner cannot rule out the sequelae of that voluntary intoxication as being the primary contributing factor to behavior, then the reason would dictate that an.
Now, this is interesting. She's been staring from what it looks like based on how the cameras moved. I believe she's staring at one of the prosecutors, and she seems to be really intently staring at him and being quite angry at this, and possibly because this is going to be the most damning part of the testimony.
Drug use can also exacerbate mental health problems, correct?
It can exacerbate them or cause them of their own accord, yes.
And this is the most important part of what he's saying, is that substances can cause these problems, because if the problem is then caused by substances, in GRI defense does not work. Now we're going to watch psychologist Christina Engen provide testimony.
It's yours. All right, doctor, how are you employed?
As a psychologist with behavioral consultants. It observed objectively occurred in the context of methamphetamine use.
She's talking about how the things that occurred during methamphetamine use, that is an objective fact. And this is something that can be confusing to people because they go, well, she's got a mental health history, but she's also using methamphetamine. What's the reason that she would engage in this behavior? And essentially, it sounds like because she engaged in the behavior, because she engaged in the murder while using methamphetamine, that many people attribute the extremeness of the behavior to the methamphetamine. That's how I interpret it. I'm not saying that that's necessarily how the psychologists are seeing it. That's how I see it.
They could have provided those materials. If they wanted, hey, please interview my client again, they could have done so. It's their burden. And they chose not to. There was additional jail records. They could have produced those. And actually, Dr. Engen's comments about that make sense. You know, her.
So as you're seeing now, she's staring pretty intensely at the prosecutor. She's blinking a lot. I do believe that she's stressed about this. Once again, she's connected to what's going on. I've seen some people comment that they really think that she's just not there at all, and I really couldn't disagree more, honestly.
And actually, Dr. Engen's comments about that make sense. You know, her findings and all the objective evidence you have is this is a meth-induced crime.
So before we go on to the verdict, I do want to say I think that the defense attorney actually did a really commendable job. I think he did a great job defending this as best as he could, because he was put in a situation where this is pretty indefensible. There was really, in my opinion, no coherent defense that was going to work very well with a jury when you have the kind of information you have about this case.
At the time the crimes were committed, did the defendant have a mental disease or mental defect? Answer, no.
You can see her affect, in other words, her emotional expression is changed entirely.
There's no answer then for question 2. It is dated this date, July 27,
No smiles, no furrowed brow. She's just sitting and listening.
2023, signed by the foreperson. There were no dissenting jurors. Is there a request by either of the parties to have the jury poll?
So at this point, she has no reason to perform anymore. Now we're seeing that the behavior was voluntary. If it was involuntary, we would still be seeing it. We would still be seeing the smiles, still be seeing staring at the camera, still be seeing the looks of anger. There's no reason to do any of that at this point because the determination has been made. So if you look, this is exactly what you get.
Request by either of the parties to have the jury,
which is she now is no longer acting out. She now is no longer doing ridiculous things. And so at this point, the performance is over. There's no point to doing it anymore. So hopefully going over this helps you better understand the mental health aspects of this trial. I know this is exceedingly complicated when it comes to psychologists talking about this, so I'm trying to not overload you with information, but to help you better understand the information that we have. If there's more that you want me to cover about the Taylor Schabusiness trial, please let me know. As far as I'm concerned, I'll probably wait until the sentencing to do more, and we'll see if there's anything that's observable or interesting about that. Until then, if there's any other recommendations you have or anything else you want me to cover, please let me know in the comments below. Last thing before we get finished up, I do want to remind you to like and subscribe if you want to see more content just like this. All right, thanks for watching.